Question 1. A 65-year-old patient is prescribed digoxin for atrial fibrillation. Which of the following signs and symptoms should be monitored closely as a potential indication of digoxin toxicity? A. Blurred vision and nausea. B. Tinnitus and headache. C. Bradycardia and hypotension. D. Weight gain and edema. Answer: A. Blurred vision and nausea. Rationale: digoxin toxicity often manifests with gastrointestinal symptoms, nausea, vomiting, and visual disturbances, blurred or yellow vision. Bradycardia and hypotension can be signs of digoxin's therapeutic action, but are not specific to toxicity. Weight gain and edema are signs of heart failure, but not directly related to digoxin toxicity. Question 2. A patient is receiving warfarin therapy. Which of the following lab tests should be prioritized for monitoring anticoagulant effect and preventing bleeding complications? A. Platelet count. B. Prothrombin time, PT, and INR. C. Hemoglobin and hematocrit. D. Serum albumin levels. Answer: B. Prothrombin time, PT, and INR. Rationale: the prothrombin time, PT, and international normalized ratio, INR, are the most important tests to monitor warfarin therapy, as they assess the blood's clotting ability and help avoid bleeding complications. Platelet count, hemoglobin/hematocrit, and serum albumin are not the primary indicators for warfarin monitoring. Question 3. A patient is prescribed atorvastatin for hyperlipidemia. Which of the following laboratory values should be monitored to detect a potential adverse effect of this drug? A. Serum potassium levels. B. Liver function tests, ALT/AST. C. Serum creatinine levels. D. Blood glucose levels. Answer: B. Liver function tests, ALT/AST. Rationale: statins like atorvastatin can cause hepatotoxicity, so liver function tests, ALT/AST, should be monitored regularly. Serum potassium, creatinine, and blood glucose levels are not typically affected by statins. Question 4. A nurse is caring for a patient who is receiving high-dose vancomycin. Which of the following complications should be monitored to prevent adverse reactions? A. Ototoxicity and nephrotoxicity. B. Hyperkalemia and hypernatremia. C. Hepatotoxicity and pancreatitis. D. Hypoglycemia and bradycardia. Answer: A. Ototoxicity and nephrotoxicity. Rationale: high-dose vancomycin is associated with both ototoxicity, hearing loss, and nephrotoxicity, kidney damage. These serious side effects require careful monitoring of renal function and hearing. Hyperkalemia, hypernatremia, hepatotoxicity, and pancreatitis are not typically related to vancomycin use. Question 5. A nurse is caring for a patient who is taking lithium for bipolar disorder. Which of the following interventions is most appropriate? A. Administer an antiemetic medication. B. Withhold the lithium dose and check lithium levels. C. Administer a benzodiazepine for sedation. D. Increase fluid intake and monitor vital signs. Answer: B. Withhold the lithium dose and check lithium levels. Rationale: tremors, nausea, and confusion are signs of lithium toxicity. The nurse should withhold the drug and check serum lithium levels immediately. Administering an antiemetic or a sedative would not address the underlying cause of toxicity. Increasing fluid intake is helpful, but not the first action in suspected toxicity. Question 6. A patient is prescribed omeprazole for the treatment of gastroesophageal reflux disease, GERD. What is a significant long-term side effect associated with omeprazole therapy? A. Osteoporosis. B. Renal failure. C. Hyperkalemia. D. Liver cirrhosis. Answer: A. Osteoporosis. Rationale: Long-term use of proton pump inhibitors, PPIs, like omeprazole can lead to decreased calcium absorption and increase the risk of osteoporosis and fractures. Renal failure, hyperkalemia, and liver cirrhosis are not commonly associated with omeprazole use. Question 7. A nurse is administering a dose of furosemide to a patient with heart failure. What electrolyte imbalance should be closely monitored with this medication? A. Hyperkalemia. B. Hyponatremia. C. Hypercalcemia. D. Hypokalemia. Answer: D. Hypokalemia. Rationale: furosemide is a loop diuretic that can cause significant potassium loss, leading to hypokalemia. While it may also cause hyponatremia, the more significant risk is potassium depletion. Hyperkalemia and hypercalcemia are not commonly associated with furosemide. Question 8. A 45-year-old patient is prescribed gabapentin for neuropathic pain. Which of the following side effects is most concerning and should be reported to the healthcare provider? A. Dizziness and somnolence. B. Increased appetite and weight gain. C. Visual disturbances and diplopia. D. Tremors and ataxia. Answer: D. Tremors and ataxia. Rationale: while dizziness and somnolence are common side effects of gabapentin, tremors and ataxia could indicate a more serious neurological effect. Increased appetite, weight gain, and visual disturbances are also possible, but are less urgent compared to motor impairments like tremors. Question 9. A nurse is caring for a patient who is taking methotrexate for rheumatoid arthritis. Which of the following should be monitored regularly due to the risk of toxicity? A. Serum creatinine and liver enzymes. B. Serum calcium and vitamin D levels. C. Complete blood count, CBC, and liver enzymes. D. Serum potassium and glucose levels. Answer: C. Complete blood count, CBC, and liver enzymes. Rationale: methotrexate can cause bone marrow suppression, leading to low blood cell counts and hepatotoxicity. Therefore, monitoring the CBC and liver enzymes, ALT-AST, is crucial to detect early signs of toxicity. Creatinine, calcium, potassium, and glucose levels are not the primary concerns with methotrexate therapy. Question 10. A patient is prescribed an MAOI, monoamine oxidase inhibitor, for depression. Which of the following foods should the patient avoid to prevent a hypertensive crisis? A. Fresh vegetables. B. Aged cheese and red wine. C. Canned fruits. D. Fresh fish and poultry. Answer: B. Aged cheese and red wine. Rationale: MAOIs can cause a hypertensive crisis when taken with foods that are high in tyramine, such as aged cheese and red wine. Fresh vegetables, canned fruits, and fresh fish and poultry do not contain significant amounts of tyramine and are safe for consumption with MAOIs. Question 11. A patient receiving morphine for post-operative pain develops respiratory depression. What is the priority action for the nurse? A. Administer naloxone. B. Decrease the dose of morphine. C. Increase the oxygen flow rate. D. Place the patient in the prone position. Answer: A. Administer naloxone. Rationale: naloxone is the antidote for opioid overdose and is the priority action for reversing respiratory depression caused by morphine. Decreasing the morphine dose and increasing oxygen may help, but naloxone is the most effective immediate intervention. Question 12. A patient with a history of seizures is prescribed bupropion. Which of the following is the most important consideration before initiating this medication? A. Check the patient's potassium levels. B. Assess the patient's seizure history. C. Monitor liver function tests. D. Assess renal function. Answer: B. Assess the patient's seizure history. Rationale: bupropion lowers the seizure threshold, so it is important to assess the patient's seizure history and use with caution in those at risk for seizures. Monitoring electrolytes, liver, and renal function is important, but not the primary concern in this scenario. Question 13. A patient receiving isoniazid for tuberculosis develops a yellowish tint to the skin and sclera. What is the most likely cause? A. Hepatotoxicity. B. Nephrotoxicity. C. Anemia. D. Hyperglycemia. Answer: A. Hepatotoxicity. Rationale: isoniazid can cause hepatotoxicity, which manifests as jaundice, yellowing of the skin, and sclera. Nephrotoxicity, anemia, and hyperglycemia are not typical side effects of isoniazid. Question 14. A patient is taking warfarin and develops a nosebleed. What lab value should the nurse monitor to assess the bleeding risk? A. Prothrombin time, PT, and INR. B. Hemoglobin and hematocrit. C. Platelet count. D. Serum albumin levels. Answer: A. Prothrombin time, PT, and INR. Rationale: warfarin increases the risk of bleeding, so monitoring the PT and IN are as essential to assess coagulation status. Hemoglobin, hematocrit, platelet count, and serum albumin are not as critical in this scenario. Question 15. A nurse is preparing to administer hydralazine to a patient with hypertension. What should the nurse assess prior to administration? A. Liver function tests. B. Blood pressure and heart rate. C. Electrolyte levels. D. Serum glucose levels. Answer: B. Blood pressure and heart rate. Rationale: hydralazine is a vasodilator used to treat hypertension, and the nurse must assess blood pressure and heart rate to ensure it is safe to administer. Liver function, electrolyte levels, and glucose are not the primary concerns before administration. Question 16. A patient with a history of peptic ulcer disease is prescribed aspirin for arthritis. What complication is the nurse most concerned about? A. Renal failure. B. GI bleeding. C. Hyperkalemia. D. Hyperglycemia. Answer: B. GI bleeding. Rationale: aspirin is an NSAID that can irritate the stomach lining and increase the risk of gastrointestinal bleeding, especially in patients with a history of peptic ulcer disease. Renal failure, hyperkalemia, and hyperglycemia are not primary concerns in this context. Question 17. A patient on long-term corticosteroid therapy begins to show signs of Cushing's syndrome. Which of the following symptoms is most indicative of this condition? A. Weight gain, buffalo hump, and moon face. B. Diarrhea, weight loss, and fatigue. C. Hypotension, hyperkalemia, and dizziness. D. Fever, sore throat, and rash. Answer: A. Weight gain, buffalo hump, and moon face. Rationale: Cushing's syndrome is caused by prolonged corticosteroid use and presents with characteristic signs such as weight gain, buffalo hump, and moon face. The other options reflect symptoms of other conditions. Question 18. A nurse is caring for a patient who has been prescribed clozapine. What is the most important side effect to monitor for during therapy? A. Granulocytosis. B. Hypertension. C. Hyperkalemia. D. Weight loss. Answer: A. Granulocytosis. Rationale: clozapine is associated with agranulocytosis, a severe decrease in white blood cell count that can lead to life-threatening infections. Monitoring blood counts regularly is essential to detect this side effect. Question 19. A patient is prescribed carbamazepine for epilepsy. What is a significant side effect of this medication that requires regular monitoring? A. Liver toxicity. B. Hypoglycemia. C. Diarrhea. D. Bradycardia. Answer: A. Liver toxicity. Rationale: carbamazepine can cause liver toxicity, so liver function tests must be monitored regularly during therapy. Hypoglycemia, diarrhea, and bradycardia are not commonly associated with carbamazepine use. Question 20. A patient on ciprofloxacin therapy reports tendon pain. What is the most appropriate response? A. Continue the ciprofloxacin and apply heat to the area. B. Discontinue ciprofloxacin and report to the healthcare provider. C. Recommend over-the-counter pain relief. D. Instruct the patient to rest the affected limb. Answer: B. Discontinue ciprofloxacin and report to the healthcare provider. Rationale: ciprofloxacin can cause tendinitis and tendon rupture, particularly in older adults. If tendon pain occurs, the medication should be discontinued immediately, and the healthcare provider should be notified. Question 21. A nurse is caring for a patient who is receiving phenytoin for seizure management. What is the most important lab test to monitor for this patient? A. Serum calcium levels. B. Serum potassium levels. C. Phenytoin serum levels. D. Complete blood count, CBC. Answer: C. Phenytoin serum levels. Rationale: phenytoin has a narrow therapeutic index, so monitoring serum levels is essential to ensure the drug is within the therapeutic range and avoid toxicity. Calcium, potassium, and CBC are not the priority in this case. Question 22. A nurse is educating a patient about using oral contraceptives. Which of the following statements by the patient indicates the need for further teaching? A. I should not smoke while taking oral contraceptives. B. I need to take a pill at the same time each day. C. If I miss a dose, I should take 2 pills the next day. D. I will report any signs of chest pain or leg swelling. Answer: C. If I miss a dose, I should take 2 pills the next day. Rationale: if a dose is missed, the correct action is not to take 2 pills the next day, but to follow the instructions for missed doses, which usually involves taking 1 pill as soon as possible and continuing as usual. Smoking, consistent timing, and reporting symptoms like chest pain are all correct points. Question 23. A patient with chronic kidney disease is prescribed epoetin alpha. What is the most important monitoring parameter during therapy? A. Blood pressure. B. Serum potassium. C. Hemoglobin and hematocrit levels. D. Serum calcium. Answer: C. Hemoglobin and hematocrit levels. Rationale: epoetin alpha stimulates erythropoiesis, so hemoglobin and hematocrit levels should be monitored regularly to assess the effectiveness of therapy and avoid the risk of polycythemia. Blood pressure, potassium, and calcium are important, but not the primary concern. Question 24. A patient receiving lithium therapy for bipolar disorder presents with confusion and tremors. What is the most likely cause? A. Hypercalcemia. B. Lithium toxicity. C. Hypokalemia. D. Hyponatremia. Answer: B. Lithium toxicity. Rationale: confusion and tremors are early signs of lithium toxicity, which can occur if the serum lithium levels become too high. Hypercalcemia, hypokalemia, and hyponatremia are not typically associated with lithium therapy. Question 25. A nurse is caring for a patient on a regimen of a calcium channel blocker and an ACE inhibitor. What is the most critical interaction to monitor? A. Hyperkalemia. B. Hypoglycemia. C. Renal failure. D. Hypercalcemia. Answer: A. Hyperkalemia. Rationale: both calcium channel blockers and ACE inhibitors can increase potassium levels, and when used together, they pose a significant risk of hyperkalemia. Renal failure may also be a concern, but is secondary to potassium imbalances in this case. Question 26. A nurse is administering warfarin to a patient. What is the most appropriate action if the patient's INR is 6.5? A. Continue the warfarin dose. B. Administer vitamin K. C. Withhold the warfarin dose for 1 day. D. Increase the warfarin dose. Answer. B. Administer vitamin K. Rationale. An INR of 6.5 is significantly above the therapeutic range, which increases the risk of bleeding. The nurse should administer vitamin K to reverse the anticoagulant effects of warfarin. Question 27. A patient is receiving high-dose heparin therapy. Which laboratory test should be monitored to ensure therapeutic anticoagulation? A. Prothrombin time PT. B. Activated partial thromboplastin time APTT. C. Platelet count. D. International Normalized Ratio INR. Answer. B. Activated partial thromboplastin time APTT. Rationale. Heparin therapy is monitored using APTT to ensure the patient is within the therapeutic range. PT and IN are used to monitor warfarin, while platelet count helps detect thrombocytopenia, not directly related to heparin's anticoagulant effect. Question 28. A patient with a history of asthma is prescribed beta blockers for hypertension. What is the most significant concern with this prescription? A. Increased risk of hyperkalemia. B. Risk of bronchoconstriction and asthma exacerbation. C. Risk of acute renal failure. D. Risk of weight gain. Answer. B. Risk of bronchoconstriction and asthma exacerbation. Rationale. Beta blockers can induce bronchoconstriction, which may worsen asthma. While they are effective for hypertension, they should be used cautiously or avoided in patients with asthma. Hyperkalemia, renal failure, and weight gain are not primary concerns with beta blockers in this case. Question 29. A patient taking phenytoin for seizure control presents with gingival hyperplasia. What is the most appropriate nursing intervention? A. Administer a higher dose of phenytoin. B. Instruct the patient to brush teeth more frequently. C. Recommend stopping phenytoin immediately. D. Monitor the patient's liver function. Answer. B. Instruct the patient to brush teeth more frequently. Rationale. Gingival hyperplasia is a well-known side effect of phenytoin. Improved oral hygiene, including frequent brushing, can help manage this condition. The dose of phenytoin should not be increased, and it should not be stopped without consulting a healthcare provider. Liver function monitoring is important, but not the most immediate intervention. Question 30. A nurse is caring for a patient on ciprofloxacin for a urinary tract infection. Which of the following complications should be monitored closely? A. Tendinitis and tendon rupture. B. Hepatotoxicity. C. Electrolyte imbalance. D. Renal failure. Answer. A. Tendinitis and tendon rupture. Rationale. Ciprofloxacin, a fluoroquinolone, is associated with an increased risk of tendinitis and tendon rupture, especially in older adults. Hepatotoxicity, electrolyte imbalance, and renal failure are not the primary risks associated with ciprofloxacin therapy. Question 31. A nurse is administering methotrexate to a patient with rheumatoid arthritis. What is the most important side effect to monitor for? A. Severe headache. B. Bone marrow suppression. C. Hypertension. D. Liver cirrhosis. Answer. B. Bone marrow suppression. Rationale. Methotrexate can cause bone marrow suppression, leading to anemia, leukopenia, and thrombocytopenia. Regular monitoring of CBC is essential. Severe headaches, hypertension, and liver cirrhosis are not the most common or critical side effects. Question 32. A patient taking lithium develops increased thirst, frequent urination, and confusion. What should the nurse do first? A. Increase the dose of lithium. B. check the patient's serum lithium levels. C. Encourage increased fluid intake. D. Administer a sedative. Answer: B. Check the patient's serum lithium levels. Rationale: increased thirst, urination, and confusion are signs of lithium toxicity. The nurse should first check the serum lithium levels to assess for toxicity before any other interventions. Increasing fluid intake may be necessary, but the first action is to confirm toxicity. Question 33. A patient on antihypertensive therapy is experiencing dizziness, lightheadedness, and syncope. What is the most likely cause? A. Hypertension. B. Orthostatic hypotension. C. Hyperkalemia. D. Hyperglycemia. Answer: B. Orthostatic hypotension. Rationale: antihypertensive medications can cause orthostatic hypotension, which leads to dizziness, lightheadedness, and syncope when changing positions. Hypertension itself is not the cause in this case, and hyperkalemia or hyperglycemia would not typically cause these symptoms directly. Question 34. A nurse is caring for a patient receiving high-dose corticosteroid therapy. Which of the following is the most significant long-term risk? A. Osteoporosis. B. Acute renal failure. C. Increased white blood cell count. D. Hypotension. Answer: A. Osteoporosis. Rationale: long-term use of corticosteroids is known to decrease bone density and increase the risk of osteoporosis and fractures. Acute renal failure, increased white blood cell count, and hypotension are not the most significant long-term risks. Question 35. A patient is receiving warfarin and develops purple toe syndrome. What is the appropriate action? A. Continue the warfarin and monitor. B. Administer vitamin K to reverse the warfarin. C. Discontinue the warfarin and notify the healthcare provider. D. Increase the warfarin dose. Answer: C. Discontinue the warfarin and notify the healthcare provider. Rationale: purple toe syndrome is a rare but serious complication of warfarin therapy, requiring immediate discontinuation of the drug. Vitamin K would reverse the anticoagulation, but would not address this specific complication. Question 36. A nurse is caring for a patient on a combination of ACE inhibitors and potassium-sparing diuretics. What is the most important electrolyte to monitor? A. Sodium. B. Potassium. C. Calcium. D. Phosphorus. Answer: B. Potassium. Rationale: both ACE inhibitors and potassium-sparing diuretics can increase potassium levels, so monitoring for hyperkalemia is critical. Sodium, calcium, and phosphorus are not the primary concern in this situation. Question 37. A nurse is educating a patient starting oral contraceptives. What should the nurse include in the teaching? A. You may stop using contraceptives when you feel comfortable. B. You should take the pill at the same time every day. C. The pill is effective immediately. No backup contraception is needed. D. You can skip periods while taking the pill. Answer: B. You should take the pill at the same time every day. Rationale: consistent timing improves the efficacy of oral contraceptives. Backup contraception may be required if the pill is missed, and while some pills allow for period skipping, it is not a general rule. Question 38. A patient receiving insulin for diabetes reports feeling shaky, anxious, and dizzy. What is the priority action? A. Administer a dose of insulin. B. Check the patient's blood glucose level. C. Offer a snack containing protein. D. Administer a dose of glucagon. Answer: B. Check the patient's blood glucose level. Rationale: symptoms like shakiness, anxiety, and dizziness are indicative of hypoglycemia. The first action is to check the blood glucose level to confirm if it is low. Insulin administration and glucagon are not appropriate without confirming hypoglycemia. Question 39. A nurse is administering a first dose of ACE inhibitor to a patient. Which of the following should be monitored closely to assess for a potential adverse effect? A. Blood pressure. B. Serum potassium levels. C. Heart rate. D. Serum creatinine levels. Answer: A. Blood pressure. Rationale: ACE inhibitors can cause a significant drop in blood pressure, particularly after the first dose, which is why blood pressure should be monitored closely. Potassium levels, heart rate, and serum creatinine are important, but not the priority for first-dose monitoring. Question 40. A nurse is caring for a patient who is receiving calcium channel blockers for hypertension. What is the most important side effect to monitor for? A. Hypotension. B. Tachycardia. C. Edema. D. Hyperkalemia. Answer: A. Hypotension. Rationale: calcium channel blockers lower blood pressure, so hypotension is the most significant side effect to monitor. Tachycardia, edema, and hyperkalemia are less common in this class of medications. Question 41. A patient receiving heparin therapy has a platelet count of 120,000 per cubic millimeter. What is the appropriate nursing intervention? A. Continue the heparin therapy. B. Administer vitamin K. C. Notify the healthcare provider and discontinue heparin. D. Increase the heparin dose. Answer: C. Notify the healthcare provider and discontinue heparin. Rationale: heparin-induced thrombocytopenia, HIT, can occur with a platelet count below 150,000 per cubic millimeter. The nurse should notify the healthcare provider and discontinue the heparin. Vitamin K is used to reverse warfarin, not heparin. Question 42. A nurse is administering propofol to a patient for sedation. What is the most serious potential complication to monitor for during therapy? A. Respiratory depression. B. Hypertension. C. Increased intracranial pressure. D. Tachycardia. Answer: A. Respiratory depression. Rationale: propofol is a potent sedative that can cause respiratory depression, which can be life-threatening. Monitoring for adequate ventilation is crucial. Hypertension, increased intracranial pressure, and tachycardia are not the primary concerns during propofol administration. Question 43. A patient on acetaminophen for pain presents with jaundice. What is the most likely cause of this symptom? A. Hepatotoxicity from acetaminophen. B. Renal failure. C. Anemia. D. Hyperbilirubinemia. Answer: A. Hepatotoxicity from acetaminophen. Rationale: acetaminophen overdose can cause liver damage, leading to jaundice as a sign of hepatotoxicity. Renal failure, anemia, and hyperbilirubinemia are not primary concerns with acetaminophen use in this scenario. Question 44. A patient with chronic pain is prescribed a high dose of fentanyl. Which of the following is the most important side effect to monitor for during therapy? A. Respiratory depression. B. Bradycardia. C. Constipation. D. Hypertension. Answer: A. Respiratory depression. Rationale: fentanyl is a potent opioid that can cause respiratory depression, which is the most critical side effect to monitor. Bradycardia, constipation, and hypertension are common, but less immediately dangerous. Question 45. A patient is receiving high-dose methotrexate for cancer treatment. Which of the following interventions should be implemented to prevent toxicity? A. Administer folinic acid. B. Monitor blood glucose levels. C. Encourage fluid restriction. D. Increase potassium intake. Answer: A. Administer folinic acid. Rationale: methotrexate can cause toxicity, particularly in the gastrointestinal and hematologic systems. Folinic acid is given to reduce toxicity, particularly in high-dose therapy. Monitoring glucose, restricting fluids, and increasing potassium are not related to preventing methotrexate toxicity. Question 46. A nurse is preparing to administer a dose of digoxin to a patient. What is the most important parameter to assess before administering this medication? A. Serum potassium level. B. Serum sodium level. C. Heart rate. D. Blood pressure. Answer: C. Heart rate. Rationale: digoxin is a cardiac glycoside that can cause bradycardia. The nurse should check the heart rate before administration, especially if it is below 60 beats per minute. Potassium levels are important, but not the most immediate concern in this scenario. Question 47. A patient on valproic acid for epilepsy develops confusion, tremors, and slurred speech. What is the priority intervention? A. Administer vitamin K. B. Discontinue the medication and notify the healthcare provider. C. Increase the dose of valproic acid. D. Monitor serum glucose levels. Answer: B. Discontinue the medication and notify the healthcare provider. Rationale: confusion, tremors, and slurred speech are signs of valproic acid toxicity. The medication should be discontinued, and the healthcare provider should be notified immediately. Question 48. A patient is prescribed clopidogrel after a myocardial infarction. What is the most important side effect to monitor for? A. Tachycardia. B. Bleeding. C. Hyperglycemia. D. Hypotension. Answer: B. Bleeding. Rationale: clopidogrel is an antiplatelet drug, and the most serious side effect is bleeding. Monitoring for signs of bleeding is crucial. Tachycardia, hyperglycemia, and hypotension are not the primary concerns with clopidogrel. Question 49. A patient receiving amiodarone for arrhythmia complains of visual disturbances. What is the most likely cause? A. Retinal toxicity. B. Hypertension. C. Hyperkalemia. D. Hypoglycemia. Answer: A. Retinal toxicity. Rationale: amiodarone can cause retinal toxicity, which may present as visual disturbances. Hypertension, hyperkalemia, and hypoglycemia are not common side effects of amiodarone. Question 50. A nurse is caring for a patient on high-dose corticosteroids. What is the most important long-term side effect to monitor? A. Osteoporosis. B. Gastric ulcers. C. Hyperkalemia. D. Hypoglycemia. Answer: A. Osteoporosis. Rationale: long-term corticosteroid use can lead to decreased bone density, increasing the risk of osteoporosis. Gastric ulcers, hyperkalemia, and hypoglycemia are not the most significant risks in this scenario.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!